Welcome to Conversations on Healthcare with Mark Masselli and Margaret Flinter. Our guest this week is U.S. Surgeon General Dr. Vivek Murthy, addressing vaccines for kids and the opioid crisis. Now, here's Mark Masselli and Margaret Flinter.
We're speaking today with Dr. Vivek Murthy, the 21st Surgeon General of the United States, the nation's doctor. He's the co-chair of President Biden's White House COVID response team, and he previously served as the 19th U.S. Surgeon General under President Obama.
Dr. Murthy is Vice Admiral of the United States Public Health Commission Service Corps, commanding 6,000 public health officers around the country and the world. He's the author of Together, The Healing Power of Human Connection in a Sometimes Lonely World. Dr. Murthy, welcome back to Conversations on Healthcare.
Well, thank you so much. It's really nice to see both of you again.
Oh, that's great. And Dr. Murthy, Pfizer just released safety data on vaccines for older teens, that 12 to 18-year-old group, showing significant protective effect against severe diseases, hospitalizations, and death, about 97% efficacy. But there's still a large sector of unvaccinated teens. I was surprised to see this recent Kaiser poll that showed only about 30% of parents of younger children plan to vaccinate their children right away. Obviously, more work, more education to do, as that is such a large gap. But once the vaccines are approved for all school-age children, will the White House be in support of state vaccine mandates for children?
Well, I'm glad you asked this question, Mark. And I want to put some of these numbers in context, because the 30% you mentioned of parents who, according to a recent poll, are ready to go out and get their child vaccinated today, under 12, kids under 12, if a vaccine is made available. I want you to think about that in the context of the same poll that was done for adults prior to an adult vaccine being available. It was somewhere in the neighborhood of about 35% of adults who said that they were ready to go out and get vaccinated once that became available. But what happened in the next few months? Number one, the vaccine became available and people had a chance to have their questions answered, and they saw family and friends who got vaccinated and who did well. And so that's why today we've got 80% of eligible individuals in America who have either been vaccinated or are ready to do so as soon as possible. And so I think with it, when it comes to vaccine for kids under 12, once it comes out, we are going to focus heavily on making sure that not only do people have access to the vaccine through tens of thousands of places, doctors' offices, schools, pharmacies around the country, but also making sure that they have access to accurate information, which is why we're building a national outreach and information initiative.
Well, Dr. Murthy, one date that is circled on the calendar is October 26th. It's the day the FDA Advisory Committee is taking up the issue of the vaccines for the 5 to 11-year-old group. And as you just referenced a moment ago, this is going to be a little bit different and maybe rely much more on the vast network of pediatric practices around the country, as well as community health centers and hospitals. And I think you've promised smaller needles and shorter lines. That'll sound good both to the kids and to the parents, both of those things. But I'm wondering, how will this effort be different? I think this is new, really engaging the pediatric practices around the country. And I think some shied away from the complications of storage and ordering and reporting. What have you done to make it easier for this very widespread distribution and in places that parents are used to taking their kids for vaccines?
Yeah, well, Margaret, the current plan that the White House has been working on to roll vaccines out to kids, if and when the CDC and FDA recommend that, this has been under development for a while, but it builds on the learnings that we have from the last year, where we've been distributing vaccine to adults and to adolescents through a variety of channels, from large-scale events to mobile units to doctors' offices and pharmacies. And one of the things that we know from parents and their feedback is that they would like to ideally get vaccinated in places that they're familiar with. They want to have conversations with people they trust. And it's why we're not only doubling and tripling down on our efforts with doctors' offices to make sure family docs and pediatricians can have vaccine in their office, but we're also making sure that when it comes to people actually getting information, they can get it from sources they trust, like their school teachers, their school administrators, and their healthcare providers. We've also been working with schools to set up on-site vaccine delivery options so that ideally a parent could go to school to get vaccinated, go to their doctor's office, go to a pharmacy, go to the local children's hospital. And the partnerships we're setting up are also ready to work with other community organizations like faith organizations to set up vaccination clinics. So the motto here is to leave no stone unturned, to provide options for people, to help them understand that we've got enough supply for all 28 million children who fall into the 5 to 11 range, and we'll stand ready to get those vaccines to kids and to their parents.
Great.
Well, that's really great. And I know, Dr. Murthy, we run around 200 school-based health centers, and I think that will be such a great value for parents. But there was some good news. The FDA just has given approval for the Moderna and the J&J booster shot with a sort of an interesting twist. Based on the study by NIH, recipients can mix and match their booster vaccines. And this move offers consumers, I think, a lot of flexibility. And in particular, in the case of the Johnson & Johnson vaccine, a much higher protective effect when mixed with a mRNA booster such as Moderna or Pfizer. The CDC still has to approve this latest decision, but maybe help the public understand what all of this means.
Yeah, it's a good question, and the process can feel complicated. So let me just break it down for your listeners, Mark. There are 4 steps to this process. The FDA's advisory committee meets, and second, the FDA makes a decision. Third, the CDC's advisory committee meets, and then fourth and finally, the CDC will make its recommendation, and then that's how we move forward. We're more than halfway through that process. We're on step 3, where the CDC's advisory committee is meeting. But last night, when the FDA rendered its decision, it did provide authorization for boosters for Moderna and Johnson & Johnson recipients who fall into a high-risk category. So that means people above 65, people with other illnesses like heart disease and diabetes that put them at higher risk, and people who live or work in places where they're at higher risk of exposure to COVID-19, healthcare workers, grocery store workers, and others. But the mix and match is also interesting because what they also authorized was for an individual who gets one of the 3 vaccines to potentially get boosted with one of the other 2 vaccines. Now, why is that important? Well, it does give people more flexibility. And we know that some individuals have wanted the choice to potentially get a separate one. We also know that logistically, if someone is in a circumstance where they can get one vaccine and not another, we want them to be able to get vaccinated as opposed to foregoing a chance to get the protection that a booster would provide. So the CDC, again, is going to weigh in on this over the next couple of days. But that is what the mix and match was about. And the data for that came from an NIH study that was done to look specifically at the mix and match and and again, look around issues of safety, look at efficacy, and that's what the FDA opined on.
Well, Dr. Murthy, it's always on our mind that this COVID pandemic has already the lives of 720,000 Americans, and we're glad to see the numbers are again slowly coming down. But we're heading into winter, and it feels like we've been here before with colder temperatures, the holidays, Thanksgiving, and the holidays beyond that in December coming up. You have such a powerful voice as the nation's doctor. What are you saying to people this fall about how we prepare for this next phase of the pandemic, which we know could involve a twindemic of both influenza and COVID? And I know people are going to be asking, this year, what can I do? How do I celebrate?
Well, it's a great question, Margaret. And, we are coming into colder season. We know respiratory viruses do tend to spread during cold weather season. But there's something we have this winter that we didn't have last winter, and that is millions and millions of people who are vaccinated. It's a big deal. At the beginning, in January, mid to late January, we had about 2 million people in the country who are fully vaccinated. Now we have 190 million people who are fully vaccinated, tens of millions of more who've gotten one shot and are on their way to getting fully vaccinated. And we're on the verge of having a decision around vaccines for kids under 12, which will mean potentially another 28 million people will become eligible for vaccines. So that is a big deal. It's a big reason why I think we will be better off than we were last winter. But here are some things for people to keep in mind. Number one, there are still 65 million people in our country who are not vaccinated, who have not had a single shot. We need to make sure that they get protection as well. So talk to your family and friends, remind them that, especially after everything we saw with Delta, it is not too late and more urgent than ever to get vaccinated. Number two, remember what we learned from COVID about what helps to reduce spread for COVID is still important for COVID and for flu. We know that wearing masks in indoor spaces help. We know that good hygiene is important, especially washing your hands. We know that ventilation is really essential, which is why the billions of dollars made available to schools to improve ventilation was so important. And finally, remember this, we've got a flu vaccine too. It's really important that people take that as well. You can get it at the same time as you get the COVID-19 vaccine. So let that not be a barrier to stopping people from getting protected against both COVID and the flu.
Great point.
We're speaking today with Dr. Vivek Murthy, the 21st Surgeon General of the United States. Dr. Murthy, the other pandemics that are rolling across the country are addiction and mental health problems and the epidemic of loneliness, which have been really core to the issues for you as Surgeon General and was central to your theme in your very powerful book Together. These issues have reached really critical mass during the pandemic, and we've seen over 100,000 deaths, overdose deaths, just in the past year. And recently, the American Academy of Pediatrics just issued a sobering report that the mental health crisis among our younger citizens, our young children, has reached this critical tipping point. There has to be a better strategy for tackling these issues. I know you have plans and focus on that. Can you share with our listeners some of your thoughts about how we might address these very difficult, very important issues?
Mark, I'm so glad you brought this up because these are the issues that don't get nearly as much airtime as they deserve, but they are the silent pandemics, if you will, that are costing us in terms of lives, in terms of well-being of both adults and children in our country. We were struggling, as both of you know, with mental health and substance use disorders long before COVID-19 came, but it has really dealt a significant blow to many of those efforts because this has been an incredibly stressful time. People have been taken away from people and social connections, which is one of the forces that we lean on to help us during difficult times. People's care has been disrupted, whether it's their medication-assisted treatment or whether it's the counseling services that they need during the pandemic. And so when putting this all together, what you find is a bit of an explanation for why it is that we've had an increase in overdoses and overdose deaths, and why we're also seeing increased rates of anxiety and depression during this pandemic. But I do think that the pandemic both creates an opportunity as well as urgency for us to act. And we can do that thinking about a few things in particular. One is there still remains an urgent imperative to expand our treatment efforts for substance use disorders and for mental health, and to integrate them with primary care, which is something that historically we have done very poorly as a country. We've got a very fragmented system when it comes to mental health care and substance use disorder care. The second thing that it emphasizes to us is that we've got to invest in prevention. We actually have programs that we know, if instituted in schools, can be remarkably effective at reducing substance use disorders and mental health concerns down the line. And they're also remarkably cost effective. When I issued the 2016 Surgeon General's report on alcohol, drugs, and health, we actually detailed many of these preventive programs in Chapter 3, but they were not really invested in the years that followed in the way that our country really needs. But finally, let's just keep this in mind too. There's a cultural challenge that we have to solve here that we cannot shy away from, which is that for far too long, we have looked at mental illness and struggles with mental health as a source of weakness. We've looked at it as something to be ashamed of. And the result of that has been that people have not come forward and admitted, not just to others, but sometimes even to themselves, that they're struggling, and they've gone without help. And sadly, that's ended up far too often in people losing their lives, and their families have obviously suffered in the process. We can't afford to walk down that path anymore. We need to shift culturally in how we look at substance use disorders and mental illness across the board. But finally, Mark and Margaret, we've got to realize that this is about more than preventing mental illness. It's also about recognizing that we have a lot we can do to enhance emotional well-being, even in the absence of mental illness. It's sort of the difference between thinking about like one half of the scale, which is about mental illness, but realizing if you're free for illness, it doesn't mean you're functioning at the top of your game. It doesn't mean that you're in an optimal frame of mind. So we need to be thinking about how to invest in emotional well-being. It's one of the reasons my office is actually working on an initiative around mental health for the country, because we've realized that look, this is an opportunity for us to really double down on our commitment and on our actions that we're taking to address mental health, but to really spur what I think is a deeper cultural shift that needs to take place that impacts not just policy, but how schools and workplaces design their curricula and their work environments to ultimately promote well-being, support mental health, and create the healthy sort of community that we need all across America.
Well, Dr. Murthy, thank you so much for putting that right in the center of your focus. And I wonder if I can ask you to comment on another group that is really in distress. And that is a lot of the nation's frontline healthcare workers. Certainly the COVID pandemic pushed people to their limits. And we know that maybe 4,000 healthcare workers actually lost their lives to COVID during the pandemic. But there's certainly evidence of some widespread clinician burnout. And I wonder if your office and you are putting some particular thought or focus into how we address this and both address the burnout that may exist today, but also build resilience for the future. We're not going to have a great, healthy country without a great healthcare workforce. And this issue of building resilience and preventing burnout, people in the field and people who will be coming into the field seems to really require our attention and focus as well.
Well, I really appreciate you bringing up clinicians and their well-being. The doctors, nurses, pharmacists, respiratory therapists, and others who have been on the front lines during this pandemic, they've been really hit hard. And I should also mention that the public health workers in our departments of public health all across the country have also been hit hard. They've put their lives at risk. They've worked extraordinary hours. They've done so in the face of just incredible demands and uncertainty. And far too often, especially for our public health workers, they've been met actually with attacks, with political attacks, with other abuses, which are really terrible because we should be thanking them, not attacking them.
Right.
But with our clinicians in particular, look, this has been a problem that's been growing for years in our country. We have an incredibly high rate of burnout among nurses and doctors. We have an extraordinarily high rate of depression and suicide among our nurses and doctors. And it's not just because we need to equip individuals with greater practices or better practices for self-care. Sure, that can be a part of the solution, but the deeper, and I think even bigger part of the problem is systemic and cultural. We have a system set up in healthcare that is not really designed to provide doctors and patients the kind of time that they actually need with each other. We sort of overwhelm clinicians with paperwork and other administrative burdens at a time when their patients are asking, why don't I have more time with my doctor? And so we've taken a lot of the meaning and efficacy out of medicine and healthcare. We've also operated in a culture that too often looks at any source of or sign of mental illness or struggle as a sign of weakness, of not being tough enough, of not being able to cut it and get it done, and which is utterly counterproductive. So if we really want to build a future where clinicians are taken care of, where we care for the people who have been caring for us, then we will need to engage institutions, healthcare institutions and educational, healthcare educational institutions as well, in the work of changing culture and changing practice. There are also important roles that payers have here as well, because we know that so much of the administrative burden that clinicians are under comes from payers as well. I'm talking about both, private payers and public payers. Yeah. So we've got to do better there as well. My office is working on this issue. We are actually looking to put together a blueprint for the country on clinician well-being that will lay out a pathway for what government, individual clinicians, healthcare institutions, payers can all do to help create the future that our healthcare workers need, and frankly, that all of us as patients require.
Well, I think that prescription for healthcare workers will be very welcomed, and we look forward to it. Dr. Murthy, while the president has not issued a nationwide vaccine mandate, he did issue a mandate for federal workers and federal contractors as well as businesses with 100 employees or more. I've noticed recently that around the world, and in particular Italy, has just issued a ruling that all people must be vaccinated before returning to work, which is far more sweeping. And we've seen such positive results with mandates that have been put in place What's the likelihood we might see a similar measure here in the United States?
Well, it's a good question. The president's goal from the beginning, as he stated publicly, and to many of us privately, is to ultimately make sure we get through this pandemic and protect people from the scourge of COVID-19. The vaccine really is the best way to do that. And it's not just about protecting people's health. It's also about getting back to our way of life, making sure our kids can stay in school, making sure that the economy can actually function, making sure that we have the peace of mind of knowing that we can see our family and friends and get together without worrying we're going to get sick. So that's where the vaccines come in. When you look at other examples in our history of when we've had an illness and then we have fortunately been able to develop a vaccine, the way we got to very high vaccination rates from measles, mumps, rubella, polio, is actually through vaccine requirements in many of our schools. In fact, nearly all of our schools in America require children to get a vaccine before they enroll. That's why we have 90+% vaccination rates for those illnesses that I just mentioned. So vaccine requirements are not new, and they also are very effective. It turns out just even with COVID-19, like workplaces and institutions that put in requirements for COVID-19 vaccines saw an average of 20% jump in vaccination rates, many of them pushing them to soar into the 90s in terms of percentage of folks who were compliant with the vaccine requirements. So the federal government, as the president has said, will use every lever it has to advance the vaccination effort because that is central to public health. That's what science and public health are telling us. But they will do so in a way that's respectful of the law, respectful of the boundaries that have been provided. What the president announced is absolutely within the jurisdiction of the federal government to require federal workers, for example, to get vaccinated, to use its authority with CMS and its authority with OSHA, Occupational Safety and Health, to also ensure that our hospitals and our workplaces are safe as well. So you're going to see more and more data, I think, that comes out in the months ahead about how these vaccine requirements are, in fact, really turbocharging and jumpstarting our vaccination rates to very high levels. And what that will translate to is just more protection across the country. And finally, just consider this. If you're a worker out there who's been remote and you're thinking about coming back to the workplace, generally you want to know that the workplace is safe. If you're a child or a parent of a child who's coming back to school now, you want to know that your school is going to be as safe as possible. We all want to come back to shop, to work, to study in places that we know are going to be safe. This is why the requirements make sense. It's why so many localities and states are considering them as well.
We've been speaking today with U.S. Surgeon General Dr. Vivek Murthy, Vice Admiral of the U.S. Public Health Commission Service Corps. He's the author of Together, The Healing Power of Human Connection in a Sometimes Lonely World. Learn more about his vitally important work at surgeongeneral.gov. You can follow his contributions to the White House COVID Task Force at whitehouse.gov or follow him on Twitter at surgeon_general or at Vivek_Murthy. Surgeon General Murthy, we want to thank you for your dedication to improving the health and the well-being of our entire nation, for your steadfast commitment to public health, and for joining us again on Conversations on Healthcare.
Margaret, thank you so much. And Mark, I appreciate it. Can I share one last thought, that's been on my mind here? Somebody asked me recently, they said, what keeps you up at night with all of these efforts on COVID? And, just thinking about it, what came out was I think perhaps not what I would have expected to say 6 months ago or 12 months ago, but having been in this COVID effort for as long as I have, I realize that the thing that concerns me most is the division and polarization that we have in society right now, because it stands in the way of us getting people the information they need, making sure people get access to life-saving treatments and vaccines. And that's really a tragedy. But to me, it points out something that COVID taught us really along the way, which is that importance of our connection with one another, our relationships with one another. When we were separated from people, we couldn't see neighbors and friends and family members. It reminded us that we truly do need each other, and we're better off when we have each other. When people were struggling in the course of the pandemic, folks lost jobs and others were trying to figure out how to care for their children at home while also teleworking. So many people stepped up to help one another. That is actually who we are at our best. When we look out for one another, recognizing we are truly stronger when we're together. But as I see some of the forces out there that are lending themselves to polarization, some of the misinformation that's driving people to turn against one another. It worries me because it means that the most important thing we need, which is to stick by one another, is something that's under threat during one of the worst pandemics that any of us has seen. So I raise that just because I think it is up to all of us in whatever role we play, whether we're in government or not, whether we are operating within the sphere of influence of our family, or whether we have a role where we have influence in a company or a school. But it's incumbent upon all of us to think about what we can do to strengthen our connections with each other, to ensure that we have environments where people can actually speak and dialogue honestly but respectfully with one another, recognizing we have a common mission here, which is to get through this pandemic. Our enemy is the virus. It is not each other. And we have to make sure that the way we engage in dialogue with each other, the way we approach our decision-making reflects that reality that we truly do need each other during this pandemic, and we will long after it's over.
What an important message. Thank you for sharing.
Thank you so much.
That, and again, for all of your leadership.
Appreciate that. Thank you both so much. So nice to be with you again.
All right.
Yeah,
Be
good to
well.
see you.